Hello everybody, welcome back. We are back again, this time to talk about something different from depression, being anxiety. It's once again myself, Zane.
Dennis.
Elijah.
And Elias.
And we're talking this time about anxiety, which is different from depression. And we're not just talking about the regular anxiety that most people face of just feeling like nervous about a test or like, maybe having to confront somebody about something, like the regular things that most people go through, but rather the anxiety disorders and like the really intense and severe cases which really affect and alter a person's lifestyle and mind. We have Logan once again to maybe share some of his insights and understandings of the issue, and we just want to go through, maybe get more of an understanding for ourselves as well as you guys so we can figure out where to go from here.
So I guess I can hit us off with anxiety.
Hit us off.
Anxiety is, in all, anxiety is just your natural response to stress. But it's natural. It happens before a test or giving a presentation. That'll cause a lot of people to be mildly nervous. It's a sub-feeling of fear, and that type of anxiety is normal. It's found in most of us. But it's when it becomes to the point that it's excessive, it stops you from being able to do the things you enjoy, simple tasks, to the point that it's debilitating of your lifestyle, is when many can be diagnosed with severe anxiety or an anxiety disorder.
Mm-hmm.
You know, like all these types of disorders, that's not just like a random term thrown out, but more like an umbrella term, like there are lots of different kinds, being like panic disorders and phobias and social anxiety disorders, and they all kind of go under this one term because when you suffer from one of them, you can either be suffering from a few of them or even all of them. It just depends on how severe it's affecting your life and your like mindset.
And anxiety is it's often mixed with other mental health issues like depression, bipolar, and a plethora of others. But compared to depression, it is treated the same, but I guess we will get into that later.
Right, of course.
And there are, like depression as well as we spoke in our last podcast, there's no clear path for what causes anxiety necessarily.
Right.
But scientists have been able to find general broad areas. These could be environmental factors around a person, such as like stress from a personal relationship, job, or school, or their financial predicament, which can lead greatly to the development of a disorder. But also things like medical factors such as medical conditions or the effects of medications, genetics from family if you have a history of anxiety, brain chemistry, and sometimes withdrawal or use of illicit substances.
With anxiety also, a lot of people suffer from like nightmares and panic attacks, and it doesn't range, can range for something like you feeling like a strong sense of butterflies in your stomach, that knot in your stomach where you're like, you just like, it makes you feel very shaky and just very weird in the hands, stuff like that, to even like increased heart rate and like about to like pass out because of just how like enclosed and scared you feel and whatever situation.
Mentioning that right there of just the like feeling like you're about to pass out, that's probably one of the biggest like effects there is, like what I'm sure you're all aware of, or at least have heard the term before, of anxiety attack, which like just includes a lot of different things that you might encounter, such as feeling faint or dizzy, or just being like really exhausted, or sweating like at a rather rapid rate, things like this. When like you're so fixated on these feelings, chances are you are suffering from an anxiety attack, which may not mean that you have an anxiety disorder, but it's obviously attributed to the people who do have this.
There are different levels to anxiety. I feel like everyone could have a basic level of anxiety, but when it gets to a disorder, that anxiety level is much higher compared to the other people.
With depression, it just seems like that's a word that people throw around loosely, as I mentioned before in other podcasts, but it does have a certain group of people that it affects very much. With anxiety, I feel like a lot more patrons, especially younger people, suffer from it a lot. From even like the littlest things can like make someone feel very anxious and just very nervous, or like, even though shy is not the right word, just like very closed off from everybody else,
And
for sure.
With all that being said, I gotta ask your guest, Logan, in your experience when you had anxiety before, did you do any of these correlate to what we've said? Would you say like they generally attribute to what anxiety is, all in all?
from your own
Yeah.
experiences, right?
For sure, I think when you're describing the anxiety attacks, it's definitely like very common for people with anxiety. I experienced them a lot where I just feel like everything got 10 times louder and like my movements became a lot more like furious, even though I'd be just regularly sitting and like just moving my arm or moving a pencil. I just feel like I'm throwing something across the room, like everything's a lot more enhanced in speed and everything, and it gets pretty scary. It usually lasts for like 5 minutes, but during that time it feels like it's forever.
Yeah, like an hour,
Yeah,
so much
yeah.
longer.
I have a question actually. From possible anxiety medication, antidepressants that you've taken, do you feel like those can stimulate an anxiety attack or possibly attribute to the start of an anxiety attack? Because maybe like a possible side effect of that.
I take I take both antidepressants and anti-anxiety medication.
Okay.
But for my anti-anxiety medication, it's more like there's this thing called lorazepam, and I only get 5 tablets of it because it's highly addictive for youth especially, and I just take it whenever I feel like I'm gonna have an anxiety attack, or if I have like a very big thing coming up and I just don't think I can handle it on my own. I take one, and it definitely calms me down. The only problem with it is that it makes you a lot more drowsy and a lot less responsive. So I may be talking like a zombie or something, like a lot slower.
Sure.
It's really honestly interesting to notice how, like, you are a young guy, Logan. You know, I've observed that about you. You're a pretty young guy. But while we have acknowledged that depression does seem to be something that is being encountered more in younger ages, it doesn't seem that way with anxiety. There's a whole plethora of older people, elders, or middle-aged people, etc., who also have these anxiety disorders. Maybe even people who previously like fought in the war, then being like subjected to like post-traumatic stress, giving them
those can correlate with each other.
So like this is a really broad thing, anxiety, which I think reaches out to a lot of people and really strikes home really personally and strongly. So I just think it's important to acknowledge that we can't like exclude anyone from how they might be feeling in these moments, whether you suffer from anxiety attacks on like the daily or weekly, or rather if it's just maybe once in a lifetime experience for you. It can have the same types of negative impacts that we have to learn to learn to maneuver by. And
it's important to understand how important anxiety is, because if it's not treated and someone does have anxiety, it's known to only get worse and worse, and we don't want that. So there are plenty of clinics, there are plenty of places you can go to get a diagnosis or talk to someone about it, because like depression, I feel that there needs to be more awareness, and more people should be sensitive to the idea of anxiety and depression, that it's not just everybody has it. There are people, those that have it, and their voices should be heard.
And speaking of the clinics and treatments, we know that the first line of attack to anxiety, one of them could be cognitive behavioral therapy, and it's mainly
Explain
done
that, yeah.
in session.
What's that all about?
So cognitive behavioral therapy, at least I've had a little short experience with it. One of the things that the therapist would use is using facts against fiction, right? So we would display the facts, right? And then we would see, display our thought processes and see how they correlate, and just to fix our thought processes on that. But with cognitive behavioral therapy, Logan, do you think maybe you can talk about your experience with that, as maybe like relating to anxiety?
Well, with cognitive behavioral therapy, I haven't done it quite a lot because I've mostly been put on medication. And I've had other issues such as depression. But when I did, the main thing that I used was a mantra, because my issue with anxiety was the anxiety attacks were getting so severe that I just didn't feel like I couldn't handle it anymore. So with a mantra, they like taught me to say like, maybe have a mantra saying like, it's okay, it's going to be over soon, like it's only temporary, and just repeat that over and over in your head. Or breathing exercises, like you breathe in and out and you control the breathing. But meditation as well, but I haven't done it a lot.
And I guess that's some great personal treatments you can do on your own aside from medication and therapy-based.
It's always important to see a healthcare professional, because not always is a self-diagnosis necessarily the most accurate. some people could have it and believe that they don't, and those that don't have it could believe that they do. And it's important to be able to differentiate between the two, whether it's just you have natural anxiety, just a little bit more than the average person, or you actually have an anxiety disorder.
Yeah, people often try to stigmatize anxiety with people who are just very quiet and very shy. People don't realize a lot of people who are very anxious and just very nervous about a lot of things are people in professions where they have to, in the socially based topic, it's just they have to go into these big social events, like when you're a singer or an actor or just engineer overall. A famous example of one guy I know, his name was Jonathan Knight. He was in a very big group back in the day, and he back in 1984 he left the group just because of the fact that for about a good few years he was facing a lot of anxiety attacks and panic attacks from just a variety of things, whether it's from the judgment from critics and as well just judgment from bandmates, and just overall it kind of kept him from interacting with anybody for a good 5-6 years. He was in his house. He just pretty much, he remember recollecting that he would stay in his house all the time. He wouldn't interact with anybody else. He'd just stay in a very secluded area on a farm, not really interacting with anybody else, and just even cutting off ties with his family, who he's very close with at the time, according to how he emphasized it.
And that's just what's so miserable about people who kind of go through this, having to put your own life, your own relationships on hold just to accommodate these disorders that you're going through. And it's not even by choice, but more just that you feel there's no other resolution or there's nothing else you can do, then at least just give yourself some own time to recuperate from this.
It's unfortunate because even especially nowadays, even I know you can't say everybody's diagnosed with anxiety because that isn't how it works, but even little things now, people walking, one person, at least in my experience and other people I know, walking past a group of people, they just feel this sense of just fear, of just judgment, and they don't like that. So I know people, including myself, I've seen groups of people who look my age, and I feel bad with myself, so I'll just go around the corner. It's the long way just to avoid that social interaction, just to avoid that judgment from the people in my head, at least.
Yeah, especially first day of school type things, trying to meet new people. You would maybe see someone in the cafeteria, try to speak to them, but you're so anxious where you can't.
Yeah, it's not even the shyness. You're just genuinely scared people are gonna judge you, because nobody likes to be judged, and nobody likes to feel the awkward one in the social setting.
Yeah, so. And the genuine belief that a lot of people end up characterizing that when they act on something, that only the worst will happen, so they never take that chance, and then that instead causes them to become more isolatory, believing that everything's gonna go wrong, just like Murphy's Law.
It's kind of and just as you were all mentioning, that's kind of how it works, right? Anxiety is something that whether you suffer from it severely or you just have it every now and then, everyone's been affected by it. We're all familiar with anxiety. From example for myself, I don't really like having confrontational encounters with people, but sometimes you have to, and when you do, you get kind of these symptoms from it that you could definitely associate with anxiety, sweaty palms, Eminem, but there's at least now you're more aware that everybody has undergone this, and whether you do fall into the category of very severe symptoms where anxiety kind of affects how you shape your entire life, it's not something that you're alone in. That's why there are people there to help you with this.
And I guess the bottom line is, you don't have to live with anxiety. There's always help out there. You can always talk to your doctor about medication. There's a lot of clinics offering anxiety therapy-based sessions to students, and it's just something.
This might be a little off topic with it, but with anxiety, I noticed that I feel a lot of anxiety or just anxious feelings get triggered from a lot of negative things in society. So I notice a lot of people in general societies can be very judgmental, even when we don't know a person. We often just want to be mean to that person for really no reason other for own comedic purposes, and people don't realize that does affect how we interact socially. It makes us feel if I do this, if they're making fun of this guy, and I feel I'm below this guy, what's gonna happen to me? So people want to avoid that at all costs, and that kind of causes this whole social anxiety to develop even further for them. So
causes a split between many people and their social interactions.
That's a really good way to put it.
Yeah.
And it's definitely a downhill spiral once you get into that type of scenario.
If you don't get help, especially, it just keeps going down.
Yeah.
All right. I just really appreciate that we were all able to be honest and upfront about this situation. I think it's really good and rather even cathartic to maybe get out your own feelings and encounters with something like this, and now share it to other people who
Talk
might
to
be
someone
feeling
close.
who might be
Might be
feeling like
feeling
they
it.
have the same thing.
Yeah, I guess it's good for them to know that they're not alone, right?
We
Because
all-
there's a bunch of people out there who suffer the same, feel the same way, and there is help.
In our minds, we all think that, you know, we're only going through this whole, like, you know, self-deprecating, anxious sort of moment in our lives. We know that when all of us are feeling this, we just put on better facades or better masks for society.
And just now leaving it off here, we know anxiety is not something that you could just take a pill and just it'll be cured, but it is something. It doesn't have to dominate your life. There are alternatives to it, and they might be difficult to find. They might be more severe in certain parts of your life, but there are ways to make it better.
Yeah, there is help. Different changes in lifestyle, seeing a doctor, therapist, even some medications help, or
There are
maybe
things to help you.
Yeah.
So thank you once again, Logan. It was great to
Logan.
have
It's
you.
been an honor having you here.
Round of applause to Logan.
Yeah, I'm not Logan.
You better be clapping too. We'll hear it. We'll hear it. All right. So everyone, this is Zane, Dennis, Elijah, Elias signing off once again.